Hello, this is Marquel Thomas, and my topic for this week is gestational diabetes. Gestational diabetes is a common complication in pregnancy. Spontaneous hyperglycemia develops during pregnancy. It is estimated that gestational diabetes affects around 14% of pregnancies globally. It usually occurs between weeks 20 and 30 of pregnancy. Pathophysiology of gestational diabetes. Gestational diabetes normally results from B-cell dysfunction on a background of chronic insulin resistance during a pregnancy. Sometimes this issue exists prior to pregnancy and can be progressive, which can lead to type 2 diabetes after giving birth. Additional organs or body systems can contribute to or be affected. These include the brain, adipose tissue, liver, muscle, and the placenta. Risk factors for gestational diabetes are similar to those found in type 2 diabetes, and they include a family history of diabetes or a family history of insulin resistance, overweight or obese, a westernized diet and micronutrient deficiencies, and advanced maternal age, usually women over the age of 30. There's an increased incidence of gestational diabetes found among women of Hispanic, African American, Native American, Asian, or Pacific Islander origin. Clinical manifestations of gestational diabetes include excessive thirst, weakness, frequent urination, blurred vision, and recurrent infections such as yeast infections. Diagnostic testing and diagnosing gestational diabetes. According to the U.S. Preventative Services and Task Force, it is recommended that all women be screened for gestational diabetes between 24 and 28 weeks of pregnancies. This is accomplished by performing a 50-gram glucose screening test. If the results of the test are greater than 200 milligrams per deciliter, the patient has diabetes, or a 3-hour glucose tolerance test. After 1 hour, greater than 180, after 2 hours, greater than 155, and after 3 hours, greater than 140, will be a diagnosis for gestational diabetes. Treatment and management for gestational diabetes. Checking the blood sugars regularly, eating healthy food in the right amounts at the right times, being active, and monitoring the baby through regular checkups and exams, and sometimes medications are indicated for treatment. The first thing suggested usually is a diet therapy to treat gestational diabetes. Diet, exercise, and checking blood sugars. Medications are for women whose glycemic control cannot be managed with the above measures. Patient education and follow-up for gestational diabetes. Educate these patients on diet modifications. They also need to be educated on checking blood sugars, how to check them and when to check them, and how often they need to be checked. Medication management if indicated, the types of medications that are available, and also how to take them. They will need to have their routine checkups done for prenatal care and any complications that may arise.